Hello, everyone. It is 11:30 Central, so we will get started. Thank you for tuning in to today's presentation, Hands-on Learning Tools for Your Sports Medicine Program. My name is Kelsey, and I will be your moderator for today's presentation. First, here is your 30-second introduction to Realityworks for those of you who aren't familiar with us. We are an employee-owned company based in Eau Claire, Wisconsin that creates experiential learning tools for teaching job and life skills. We got our start over 20 years ago when former NASA engineer Rick Germain created the first RealCare baby infant simulator, then went on to found the company that is now Realityworks. Today, our training tools combine curriculum with hands-on learning tools, student activities, and assessments. Baby is still around, but now you can look to us for tools like our bovine birthing and ultrasound simulator, virtual reality welding simulator, wearable geriatric sensitivity suits, and if you have some time, we encourage you to check out our website and see it all. Presenting today, we have Molly Kellgren. Molly is the Health Science Product Manager here at Realityworks and has been with us for over 2 years. She is a PhD prepared registered nurse with specialized skills in education and the use of simulation as a teaching and learning strategy. She has an in-depth background of health science and simulation. She is a great resource for today's presentation. Before we get started, I want to cover a couple things. First, today's presentation has been pre-recorded and all attendees will receive a link containing the recording, as well as a copy of the PowerPoint slides and free resources. For those of you attending live today, you will also receive a certificate of completion for attending today's presentation. Keep an eye on your email. You will receive that email within 24 hours after the presentation, and we will have time at the end for Q&A. So feel free to type your questions in the chat or Q&A feature located at the bottom of your screen. With that being said, I'm going to go ahead and pass things over to Molly.
I appreciate everyone taking time out of your busy schedule to join us today to talk about hands-on learning tools for your sports medicine program. So, what are we going to talk about today? We're going to talk about why hands-on learning is actually important. We're going to hear from an instructor, a boots on the ground sort of guy who is using our sports medicine products in his classroom, about why he thinks hands-on learning is important. And then we're going to talk about how Realityworks can help you with your hands-on learning tool needs for your classroom. We'll do a quick demo of a couple of products, and then we'll provide some free resources for you at the end. So let's get started. So why hands-on learning? Well, the short answer is that experiential learning actually works. I love this data that says that we retain 75% of what we do compared to 5% of what we hear. And I can only imagine that that 75% number actually increases when we practice something over and over again. Research backs up the efficacy of tools and activities that are interactive and hands-on, but especially wearables and simulators. In fact, experiential learning benefits many learning styles. You can learn more about those benefits by reading the blog that's linked on the screen right now. For the theory lovers out there, David Kolb developed his experiential learning theory model and published this work in 1984. The theory outlines a 4-stage cycle of learning. First is the concrete experience. It's a new situation for the learner, or a situation that is existing but has changed in some way in light of the addition of new or different information. Reflective observation happens when learners look at that new situation and try to understand it based on their existing knowledge. This is a stage where learners might say, "This is different than what I knew to be true before. How can I make sense of this?" Abstract conceptualization happens when learners take this new information that has been learned and adjust their current ideas accordingly. Active experimentation is when the learner takes that new reality and tries it out for themselves. So this can really be a never-ending loop of knowledge development. It's reported that 10 out of 14 students taught by an experiential method expressed significantly more positive attitudes towards their learning. There are many benefits to using hands-on learning in your classrooms, and more specifically, the hands-on learning tools that Realityworks has available for you. First is the opportunity to integrate more realism into your classrooms, especially in health science and sports medicine. Reading words from a textbook is not realistic. Watching videos of other people performing skills is better, but it's still not on par with actually doing something hands-on. Hands-on learning engages students, period. Getting up and out of their seats, working with a learning tool forces involvement. These types of activities enable the development of soft skills. Being able to work with a tool in the collaborative classroom environment starts students in their practices of listening, communication, and teamwork. 65% of learners identify as being visual learners. Using hands-on learning tools to demonstrate skills reaches this group of learners especially and makes content tangible and memorable. Experiential learning forces the learner to have an understanding of something, try it out, and then actively think about whether things went as planned or if they need to shift what they think they know. Sports medicine is a hands-on sort of career. There's no sitting behind a desk and reading about sports medicine. So it makes sense that a career that requires you to be hands-on in your practice would require an education in which you're hands-on as well. Recently, we had the opportunity to visit Eli Zuxworth. He's the director of athletics at Redlands Community College in El Reno, Oklahoma. Realityworks brought along a couple of hands-on learning tools for Eli and his students to try out. Here is what Mr. Zuxworth has to say about hands-on learning.
Before having these tools, a lot of lecture. You simulated it the best you could with diagrams, videos, things of that nature. Uh, Usually used human models the best you could. But again, human models don't typically have dysfunctions, most likely. So being able to sit there and show them what an ACL tear feels like is very difficult, or a dysfunction. So you did the best you could. Being able to sit there and have them on demand and having not have to work around somebody else's schedule as your human model is definitely beneficial. I think it's important for every class to have some sort of hands-on component. Um, every student and learner actually learns differently. So being able to sit there and accommodate other learning styles is imperative for everybody to get the same experience in learning. This also allows the hands-on part to support what your lecture is and also reinforce points, and especially the important points and techniques, especially in these classes, on how to evaluate a particular area or also sit there and demonstrate a technique. A lot of students aren't able to sit there and get the hands-on experience, especially with certain injuries, until there is one. But being able to sit there and give them a little bit of experience prior does make, whenever that emergency does happen, a much easier thing for them to handle. Realityworks products have been fantastic in being able to sit there and show that hands-on, and also that injury that may or may not exist in the real world. And being able to sit there and do it on demand and not have to wait for the unopportune time for that injury to show up to be able to show somebody is definitely helpful. A reality, and especially whenever you're working on scenarios or if you're working on an evaluation, you can sit there, for instance, I can sit there and manipulate the products into a way of that the student's having to figure out what the evaluation or the diagnosis or assessment should be, but also be able to sit there and test them by watching them and not have to sit there and go, well, I think they did it okay. I can actually see it. So everything I can do is right there, and so I can evaluate whether it's working or not. And it's hard to evaluate in some sort of standard if the testing form is inconsistent. Being able to sit there with these models and these tools, being able to do consistent testing is huge, and it's repeatable over and over again. Um, Whenever I was a human model, I will tell you, after a while, you get sore with somebody messing with you and poking on you. The models don't complain. They're not going to get tired. They can lay there all day long, and that's huge. And it's also consistent. I can consistently set a third-degree ACL sprain. I can set a second-degree MCL sprain without any issues.
Okay, so thanks to Eli for telling us about his experience and his thoughts about hands-on learning. So now we're going to take a few minutes to take a look at a couple of the hands-on learning tools that Realityworks has available to help you in your sports medicine classrooms. We'll give a brief overview of each, and then we'll do a brief demo of each product afterwards. First is our knee and ankle sports injury assessment trainer. This is a really unique product. This hands-on tool allows learners to perform diagnostic tests to determine if there are knee or ankle ligament or tendon injuries. Through the dials on the trainer that you can see on the lower right-hand part of your screen, the instructor can choose the injury and the degree of injury for their students' practice. For example, the instructor can ask students to perform a Lachman's test on the ACL, for example, to feel a normal ligament, then compare that to a first-degree tear, a second-degree tear, and a third-degree tear. These are experiences that do not come along often in real life, as Eli was mentioning. Typically, students read about the diagnostic tests in their books, and perhaps they watch a video demonstrating the performance of these diagnostic tests, and then they practice their technique on one another. But of course, the majority of their colleagues are going to have perfectly healthy ACLs. So really, they end up getting practice on a whole bunch of normal ligaments and tendons. Very occasionally, a classmate may have an old injury that they are willing to have others assess, but you simply can't count on it. They most often do not get the opportunity to feel with their own hands what those injuries feel like. Tools like this one ensure that all of your students are getting access to all these scenarios prior to graduating into their own professional practice. A common piece of feedback we at Realityworks have gotten from practicing professionals is something along the lines of, boy, I wish I'd had this when I was in school. I didn't actually feel an Achilles tear until my third year of practice. Students can also practice their skills over and over until they feel they have reached competence. The second product that we'll be talking about today is the Lower Extremity Dislocation Trainer. This trainer allows learners to practice techniques for relocating dislocated joints. The patella dislocates both medially and laterally. The ankle dislocates anteriorly and posteriorly. Again, the powerful learning piece here is giving students the opportunity to practice skills over and over again that they would never have had the opportunity to actually perform.
Next is our upper extremity dislocation trainer. This partial torso trainer has realistic skin and joints and great range of motion. With this one trainer, your students can practice relocating 8 different types of dislocations. There's anterior and posterior dislocations of the shoulder, a simple dislocation of the elbow, and dislocations on 3 different fingers, a volar dislocation of the thumb, lateral and medial dislocations of the pointer finger, and volar and dorsal dislocations of the middle finger. The trainer also comes with 2 straps to easily strap down to a classroom or exam table.
Okay, so let's demo. And there you go. I'm hoping that you all can see our knee and ankle sports injury trainer. I want to give you a couple of different points of view here. So we're going to get a close-up, first of all, on that dial that we were talking about before. And you can see the 7 different injuries listed here. For the knee, we have ACL, MCL, and LCL. For the ankle, we have Achilles tendon, ATFL, CFL, and deltoid ligament. So any of the diagnostic tests that you would use to assess those types of injuries in practice can be performed on the trainer. You simply move the dial to move from a 0, which is a healthy setting, up through the different grades of injury to the most severe at 3. In the case of, for example, the Achilles tendon or the CFL, we're just going to have a healthy state and a torn state, completely torn state. So let's talk about the Achilles tendon for a second. I'm going to move my view again. So go back out a little bit. This trainer, you can move into a whole bunch of different positions. Any way that you want to assess your patient, you can move this trainer around. You can have it hanging off the end of the table. And in the case of the Achilles tendon, you can actually turn it upside down. If you'll keep your eye on the foot, one of the most basic Achilles tests is to squeeze. And when we have an intact Achilles tendon, we're going to get that reaction because that tendon is intact. But if we change the setting to a torn Achilles tendon, you'll see that there is no movement now in that foot because that Achilles tendon is torn. So that is the most visible way that I can demonstrate the knee and ankle trainer. But as I mentioned, you can do, a Lachman's test for the ACL, you can do anterior drawer, you can do any of those diagnostic tests and really feel the nuances between the different degrees of injury. And this, again, is often the only time your students will get an opportunity to practice these skills over and over again and to be able to pick up on those subtle differences between degrees of injury. Okay, so I am going to now switch over to our lower extremity dislocation trainer. So excuse me while I change out here. Okay, so you'll see this looks really, really similar to our knee and ankle trainer, although it does not have any dialing on top. You can do, as I mentioned before, some patella dislocations, both medially and laterally. So the lateral, you would just simply push the patella out of place, and then your students can practice the process of popping that patella back into place. So we can see it again going in the medial direction, and again, that technique of being able to pop that patella back into place. The ankle also dislocates, as we mentioned, and you can see that dislocation now. Let's see if I can move this a little bit just so you can see it a little bit better. So you can see that's dislocated now, and then you can either do this with a one-person method of relocating the joint, or you can have a second person to provide some counter traction in order to get that joint back into place. So that is our dislocation trainer. We're going to do a quick demonstration of our new upper extremity dislocation trainer. Our upper extremity dislocation trainer has dislocations located at 3 different places: shoulder, elbow, and fingers. So with the shoulder, there is a possibility to dislocate both anteriorly and posteriorly. And then your students can practice relocating that joint. We have a simple dislocation at the elbow. And then we have 3 different fingers that have dislocations. We have the thumb that will do a volar dislocation. The pointer finger will do a medial and lateral dislocation. And then the middle finger will do both volar and dorsal. And we'll walk through some examples here in just a moment. On this side of the trainer, we have a locking mechanism. This just simplifies the process so you don't accidentally dislocate the elbow when you are working with shoulder dislocations. So it's in a locked position for the elbow when you're working with the shoulder. You can unlock that when you actually want to complete practice with the elbow dislocations. So let's demonstrate one of our shoulder dislocations. This is the anterior dislocation. You can see where the joint is and how the shoulder is moved towards the front of the body. Now your students can use the techniques that you teach them in class to relocate that joint. So I've unlocked the mannequin in order to be able to work with the elbow dislocation process. So we can go ahead and dislocate our elbow. You can now see that dislocated joint at the back of the elbow that is a prime indicator when this type of injury occurs. So again, now you can have your students use the techniques that you teach them in class in order to relocate this joint. There are dislocations on 3 different fingers on the trainer. The first is the thumb, to a volar dislocation. With the pointer finger, you can do both a lateral and a medial dislocation. And then with the middle finger, you can do both a volar and a dorsal dislocation. So again, you can use the techniques that you teach in your classroom to help students learn the process of relocating these joints at a time when it isn't so stressful or dangerous as working with live patients with injuries. So let's talk about some free resources for you. What does Realityworks have to provide? In addition to our actual products, which I should mention, all of our products come with curriculum that's been fully developed by subject matter experts. So you get teacher presentation slides, student activities, pre and post assessments, all sorts of resources that actually come whenever you purchase one of our products. But aside from that, let's look at some other free resources that are available for you. Our first free resource is our Sports Medicine Implementation Guide. This can be accessed from the hyperlink that we have on the slide here. So when you get this material sent to you within 24 hours, as Kelsey mentioned, you'll be able to access these hyperlinks very easily. This guide gives you suggestions for a package of products that we have available at Realityworks that can help you build your sports medicine program from the ground up. It also includes, on the right-hand side, that grid is actually a curriculum overview. So you can easily visualize the topics that can be addressed with our tools, along with the estimated teaching times if you use the resources that we provide. So this sports medicine package is actually one that we've put together, but please know that you can put together any sort of a kit like this, and it is customizable. So you don't have to only purchase a package that we put together for you. More free resources. We have links here. The first is a great interactive poster. The second chunk, we give you access to several units with free lessons for career exploration, including for sports medicine. So those hyperlinks are there for your use. Even more resources, yes. We have a blog. Did you know we had a blog? So please feel free to visit our blog to read about things across the portfolios that we have available at Realityworks. One of our blogs, this is the second listing here, is actually specific to our lower extremity dislocation trainer. So use that second link to access that blog, and that is directly related to our site visit with Mr. Zucksworth in El Reno, Oklahoma. And then we have webinars like the one that you're listening to right now. All of our webinars are archived, so you can go back and revisit ones that you've seen before. You can check out things that maybe you missed along the way. but they're there to help you whenever you need them. Here's a QR code that we would encourage you to scan. It should work on your screen just fine. This will send you to a short number of questions for you to answer, but it will connect you with your Realityworks account manager so that they can help you figure out what your needs are for your sports medicine program.